This is Ask JVT, a 5 News Tonight special. Good evening, welcome to the programme. Now, we are giving over a large part of today's show to putting your questions to one of the key people in charge of our fight against COVID, Deputy Chief Medical Officer for England, Professor Jonathan Van-Tam. Now, he became a familiar figure, joining the Prime Minister at press conferences throughout the pandemic, winning people over with his clear talking and metaphors about football and trains. But through it all, he has been a crucial part of the team of scientists and politicians making decisions that have affected all of our lives. Well, I caught up with him this afternoon to get some of your questions answered. Jonathan Van-Tam, really good to have you on this 5 News Tonight special. Professor, first of all, let's just clear this up. Can I call you JVT?
Yes, you can. Absolutely.
That's brilliant. You can call me CL, so we're even. So the first thing I'd really want to talk to you about is, of course, the start of the week, Prime Minister Boris Johnson made that crucial announcement that everybody was wanting to hear when and how we'll be going out of lockdown in England. There's been criticism from both sides that it's actually too fast, too slow. The first thing that's definitely going to happen is schools in England open again on March the 8th. And can I just give you some questions from parents, from carers who are quite concerned about this or have questions about this? First of all, one question from a viewer is asking, schools is a big topic, and for Karen, she's saying, is it really safe to send all children back on the same date, and should everyone wear masks in class?
OK, well, it's just so important that children do get back to school that the Prime Minister has taken a decision with his ministers that children will all go back on the 8th of March. And we are, of course, now in a position where disease rates, whilst still high, are falling really quite fast. And there's no question that children get COVID, but there's also no question that, by and large, they're really kind of mildly affected. And we will see some transmission in schools when children return, but it'll be very difficult to tease out whether that's kind of what goes on in the classroom versus what goes on at the school gates or in socialising after school. But all of that is really important for kids to get back to. And we think with the vaccine rollout happening as fast as it is, with the data we're already starting to see earlier this week, that the vaccine programme we've got going in the UK is already producing real-world data that the elderly are being protected, that, cautiously, and that should be the first step in this roadmap that will take us, we hope, to somewhere which is a much more comfortable place to be by the summer.
OK, here is a question from Vala, and she is a stay-at-home mum.
Why is there a delay on two households to meet or groups of 6 outside when the schools are opening on the 8th of March?
So it is absolutely true that we are much less concerned about transmission outdoors than transmission indoors. But if you ask me what was more important, socialising or getting our children back into school, it's absolutely getting the children back into school. And I guess your line of argument then goes, well, why can't we do both? And that's exactly what we mustn't do. We must actually do things in measured steps so we can see the effect of each step before we then take it another step further and relax a bit further.
OK, here's another question, a video question from Liza this time.
Why aren't teachers being vaccinated as a priority?
The Office for National Statistics give us the death rates now for teachers as an occupational class from 9th of March last year to the 28th of December last year, and these are for England and Wales. And for teachers, men, the death rate was 18.4. This is COVID. This is involving COVID, so COVID deaths, 18.4 per 100,000, and in males, not teachers, in the similar age and obviously the same sex, it was 31.4. And for females, teachers, it was 9.8. And for comparable age groups, again, in the general population, 16.8. So actually, there's just not a shred of evidence that teachers have a higher risk of dying than people of the same age in the general population. That's why our priority is always going to be targeting, first of all, mortality and then hospitalisations. But no final decisions have been made, and the JCVI is looking at what will happen next in phase 2.
We also got some questions on travel as well. Carol Ann is a charity worker, and this is her question.
Am I going to get on holiday this year? And also I'm very concerned about vaccine passports. I don't think vaccines should be mandatory. Is that something that you think is going to happen?
So I think it's just too early to judge the holiday situation, particularly the holiday abroad situation. And that's not just about where we will be by, shall we say, June, but it's also about where other countries will be by June and how they will feel. I don't believe anybody should be forced to be vaccinated. But by the same token, I can't tell you whether other countries will insist on some kind of proof of vaccination as an entry requirement for tourists from around the world, which might well include UK tourists. You know, we do already have countries that ask for evidence of yellow fever vaccination before tourists can enter. And, you know, this isn't about what we do. This is about how the whole international response is. And remember that people are desperately trying to get trade and tourism back to normal. And so I think it's kind of beyond the borders of the UK where this will be played out, and I can't give you a clear answer.
OK, well, now the vaccine programme is obviously a key part of our fight against COVID. The UK was the first country in the world to approve the use of the Pfizer-BioNTech vaccine, with the most at risk getting their jabs from early December, like 91-year-old Margaret Keenan. Now, there's now a range of jabs in use, and almost 18 million people have now had at least one dose. But, of course, there's been questions over the decision to increase the dosing gap and concerns about disinformation putting people off getting it altogether. Well, the first question is actually going to be from myself and the 5 News team. Since the 15 million target has been hit, there seems to have been a drop-off in vaccination numbers. What's going on? Are there supply issues?
Yeah, the statistics speak for themselves. The last week hasn't seen the same levels of vaccination, and there are supply fluctuations. I'm not going to, you know, mince my words here. When a manufacturer puts on a batch of vaccine, what comes out the other end, because it's a kind of, you know, biological product, it's not just a very simple chemical. What comes out the other end is what's called a vaccine bulk. And it can be of a different concentration each time. And that therefore affects the number of finalised doses you can make. So it's quite a variable process. And these manufacturers, they've never made COVID vaccines before. We're very grateful to them for working around the clock for doing it. But we have to accept that they are in the first, 2 or 3 months of making these in very high volumes. And there are going to be these kind of comings and goings a bit.
The next question is from Cavery. She is a doctor working on the front line in Birmingham.
I had a question about why the asthma criteria for prioritisation in vaccinations is so restrictive. It's quite specific, and I worry that it leaves out a lot of vulnerable patients who should be vaccinated as a priority.
I'm an asthmatic too, and I understand. Therefore, I understand the the sensitivities here. But they looked at it very carefully, and they were informed by data also from the COSIN study in Liverpool and data from the Open Safely study, and they looked at the risks of death, and they could pick out really quite detailed, particularly from the GP records in the Open Safely database, who was at risk of dying. And it is definitely, unfortunately, the patients with severe asthma and with unstable asthma. And that's why the criteria don't apply to every single person who carries a blue Ventolin inhaler. And there's a reason for that it was a very carefully considered decision.
OK, so just today we've got the news on those with learning disabilities now being prioritised in getting the vaccine. It's after Jo Wiley spoke out about her sister's case. Is this something that should have been done sooner?
Right, so actually what you've seen today is actually the JCVI repeat their view that when it comes to learning disability, the really high risks of increased mortality are in people with severe or profound learning disabilities or Down syndrome. And those people were already on the JCVI priority lists, and they have reaffirmed that they should stay on them. What they've done is they've said, we understand that the way this is coded in GP records is difficult sometimes, and therefore a kind of fail-safe that makes sure you've really caught all of the people with severe and profound learning disabilities is to offer vaccine to everybody who has already at this point been flagged in the GP records as having learning disability. In other words, they're on the learning disability register.
OK, this is a question now from Elkin.
My question is if this vaccination or this vaccine will cover all type of variants like Brazilians or South African variants?
The data we've just got back in the last few days from Public Health England and from Health Protection Scotland are now showing us that in the healthcare worker study called Siren, that vaccines are preventing, after the first dose, 76% of infections, be they symptomatic or asymptomatic. And from the Public Health England data sets, we were already showing that taken together in terms of the reduced risk of infection and then the reduced risk of hospitalisation and death, that in the over 80s from Pfizer for the first dose, that we are already seeing that the vaccines reduce severe illness by no less than 75%. And from the Scotland data, they've looked at Pfizer and AstraZeneca and are showing a reduction in COVID hospitalisation for Pfizer after one dose of 85% and for AstraZeneca after one dose of 94%. So very, very persuasive data. And almost all of those data were gathered looking at the Kent variant, the B117, as we call it in the science community. But that's the one that emerged in the southeast of England in Kent, we think, just before Christmas. So do our vaccines work against the current variant that is causing more than 95% of illnesses in the UK? Absolutely.
With all of that, there is vaccine hesitancy, a real huge problem with lack of take-up. So this video is coming from Nurul, who really just doesn't trust what he's been told.
For myself, I don't believe in that vaccine. My only question to the government that would appreciate if they come forward and tell us the truth of the effects of the coronavirus vaccine.
So almost all side effects from vaccines occur in the first few days or the first couple of weeks after vaccination. We look, I don't personally, but the MHRA, our regulator, look at the safety reporting literally every day. We've now vaccinated over 17 million people. It might have gone over 18 million sometime today. That's a very large number of people now, a huge number, way, way, way more than were ever in the clinical trials, which have been kind of typical size of about 40,000. And that's big, but 17 to 18 million, that's huge. We are not seeing any kind of untoward safety signal, just the usual expected things such as sore arm, headache, bit of aching, bit of flu-like feeling the next day.
Since the start of the pandemic and continuing even now this week, the government has been criticised over its handling over the pandemic, its decision-making, the messaging it's been sending out to the nation. We are now standing at more than 120,000 people dead from this. Have you been frustrated by the government's decision-making? Do you think fewer people could have died?
This is such a complex question. I mean, the death toll around the world, including in the UK, is awful. And every single one is a tragedy. But it is a complex question that's going to have to take, years of study by academics, formal inquiries to kind of get to the bottom of it all.
I know you love a transport metaphor, so where are we today, and do you see the final destination being getting to that pre-COVID times?
I think we're going to have COVID-19, SARS-CoV-2 virus with us for the foreseeable future. I think with vaccines, we can get ourselves to a place by the summer where we can cope in a relatively normal way with this. We may have winter surges for quite some years to come. We may have to take some measures in years to come. But I think by and large, once we get on top of it the first time with vaccines, then we're going to be in a completely different place and much, much, much closer to normal life again. There will always be some aspects that will be a new normal rather than a full return. And the transport analogy, here's one for you. Right now, we're on the downward slope, and we're in a car, and we've got the handbrake on, and the handbrake is partly applied. That's the vaccines, where we've begun the rollout. We've got through the first 1 to 4 cohort priority groups with the first dose, but there's a second dose to give, and there's more people to do yet. And the measures we have on until the 8th of March is the foot brake. We're pressing down on that. And you know what it's like in a car. The moment you take your foot off the brake, you're going to roll down the hill. And therefore, we need to take that foot pedal off very slowly. And we need to make sure that the handbrake, that's the vaccine, is holding as we do it. Nobody on a steep hill is going to just pull the handbrake and just, in one move, just flick your foot off the brake pedal. You ease it off slowly and you make sure that your handbrake is holding before you do so. And that's where we are. But I think it's a good handbrake, and I think we are going to get to a much better place by the summer.
Come June, if most restrictions are removed, what are you looking forward to doing?
Well, I'm looking forward to seeing my mum and my sister, who don't live with us. Of course, I'm looking forward to that a great deal. But I guess I'm kind of framing it slightly further than June, hoping that the football will be back, hoping that in July I can at least get to some pre-season games and then the start of the season in the new stadium at Boston United.
Well, I think it's something many people share with you, Professor Jonathan Van-Tam. Really good to have you on this 5 News Tonight special. Thank you.
Thank you.